Dr. C with Healing Arts Physical Therapy, and I want to tell you guys about a story about myself where I was having some shoulder issues in the past. I couldn't get past doing a push-up, especially a military push-up, and also dips was very painful to my shoulders, to the front here. So what I ended up having was called bicipital tendonitis. So I was having a lot of pain in the front where this biceps tendon, so you got the biceps here, and it has two tendons that come up into the shoulder, and they split off. One head is called the long head, the other one's called the short head. It comes in here. So that long head was giving me a good deal of trouble. It was inflamed, and it wasn't allowing me to do those workouts that I wanted to do. Okay? So let me show you one of the workouts that was very painful. So I would come like this, and do a push-up position either on using my fist or down like this, and I try to do a military push-up here. And then I'm pushing up, it was very painful in the front of the shoulder. Also going down is very painful. So I pretty much just have to stop after one or two repetitions. But I want to show you guys some treatment techniques that we would use to manage a person with that condition of the shoulder via using taping techniques, hands-on therapy, deep tissue massage, and then also education on a proper form during the exercises, and showing them exercises how to build up strength around the shoulder and mobility. So that's what I will be showing you here in the upcoming portion of the video. A hands-on technique to do a release of the biceps tendon would be, first I would get into the heart of the muscle here, into the bicep itself, the belly, the red meaty part of the muscle, and use my thumb and just do some cross-friction work on that. So I can work on taking it back down here, stretching the muscle at the same time as I massage it. Okay, and then I would get up in here into the bicep tendon and do some cross-friction massage across the front of that tendon there where it goes to the bicipital groove. And I do that for several minutes until I feel like that part releases and starts to feel better and gets less tightness. And the patient will usually say they start to feel better and becomes less tender. And another common area that gets tight is the pectoral muscles. So right here in the front of the chest, these get tight and they can cause the shoulder to round forward and tip forward. And so that can cause a lot of compression up here in the front of the shoulder. So doing some manual release on those muscles can improve the flexibility and the position of the shoulder blade. And then also I would do a stretch to the muscle as well after I released it. And then hold that stretch for about 30 seconds. And then also I can work on getting more rotation of the shoulder, looking to see if they have tightness in what's called external rotation. And if they do, I would stretch that. Also, a lot of people get tightness into internal rotation of the shoulder, which can lead to the arm bone going forward in the socket, and that can cause more compression on the biceps tendon and also cause impingement syndrome. So stretching out this internal rotation is very important. Really cool technique is what's called myofascial cupping. So I already have the cup in place here over the biceps tendon. So the purpose of the cupping is to draw the skin up away from the deeper layer called the fascia layer and also into the muscle layer. So as soon as that skin is drawn up, it helps that area to breathe. It brings in circulation, allows that muscle to become flexible and move smoothly through the front of the shoulder. So I'd apply the cup there to the front of the shoulder, and I could just kind of work it around a little bit like this, up and down, side to side, wherever it feels tight, and just work it at different angles. Now do that for several minutes, and then afterwards you can see that it's left with a nice little bruise. It brings up a lot of capillaries, blood supply here, which is good. Actually, the more bruised it gets, the better the technique. That bruise can last for a few days, but the way that people feel afterward is amazing.